Back to Louisiana Living.
Welcome back. I'm joined now by Carolyn Braggs, owner of Supreme Home Health, as we continue to celebrate National Home Care Month. Carolyn, thank you so much for joining us today.
Thank you for having me.
Of course. So I know you've been on a few times kind of talking about home care and the importance of that. So kind of tell us a little bit about how rewarding this has been for you to serve people in their homes.
It has been extremely rewarding knowing that the service that we're providing is helping to improve their quality of life and help them to remain at home in the care of their family and friends and in their community, and also getting to know the patients. We really form a bond. And, you know, as a nurse, it is just something that happens as you provide care. So
awesome.
I really love it.
That's cool. And you really enjoy, like you said, you just love it, and you've really enjoyed that time. And so if someone was interested in maybe wanting to join the team, maybe find out more about it, what does that look like as doing home care as a career?
Well, it is a very interesting aspect of healthcare, because most nurses start out doing shift work where they work in a hospital or some other industrial facility, and they work probably 12-hour shifts for 5, 6, or 7 days in a row. But with home health, we work Monday through Friday. We work 8-hour days, and so we take call on a rotating shift. So we still have to work on the weekends sometimes, but it's just not as grueling as those 12-hour shifts. So it's more acclimated to family time, so a person will be able to spend time with their family, and, you know, like with these shorter days, you won't be going to work in the dark and going home in the dark as well.
Yeah, well, that's a great option for people looking for that. And if someone was interested in applying, how would they do that?
Well, they can just come by our office. It's located at 1110 Jackson Street, Monroe, Louisiana. It's on the corner of Jackson and Texas Avenue.
Okay, perfect. If someone's listening right now and they're trying to decide, you know, what the difference between some of the care is, tell us a little bit about the difference between skilled home health care and personal care.
Okay, skilled home health care is what we started off doing in our agency, and it's just like it says, we're providing skilled care. So the care is basically provided by someone with some type of license or certification, registered nurse, LPNs, therapists, therapy assistants, certified nurses aides, and also medical social services. Whereas long-term personal care, it is a they call it a non-skilled profession, and it's mainly doing homemaker and housekeeping services of some meal preparation.
Gotcha. Okay, well, that's awesome. Well, thank you so much for coming on, telling us a little bit about this. I know if people want to see more about this, they can go to our website, michaelmiss.com. Thank you so much.
Thank you.
Of course. Next, Adrienne LaFrance Wells is here with this month's West Monroe Minute. That's coming up after the break here on Louisiana Living.